morning, everyone, and thank you so much for those well wishes. I will be sure to pass that message on to my better half when I see him in Jamaica. Yes, so I'll be off for a few weeks. I'm going to take some time, as this week is a very special week for me and my family and my future to be. So when you see me next, you'll have a different last name. So today I'm going to be continuing our topic that we discussed last week. That was specially requested. The requester knows themselves, and that is on hormone imbalance. So last week we talked about, what it is, how you get it, and all of that. So today we're going to touch on a few of the things, and I'm going to go through them as quickly as possible because I don't want to bore you too much. So what are some of the conditions that are caused by hormonal imbalance? So there are dozens of medical conditions that are caused by hormone issues. Some of the most common hormone-related conditions include irregular menstrual cycles, polycystic ovaries, infertility, acne, obesity, diabetes, just to name a few. So what kind of doctors treat hormonal imbalance? So the doctor that treats hormonal imbalance is not your regular medical doctor. Now, your healthcare provider will ask you questions and ascertain certain information from you that can lead to him determining that you need to see the specialist. And that person is an endocrinologist. So an endocrinologist is a healthcare provider who specializes in endocrinology, a field of medicine that studies conditions related to your hormones. They can diagnose endocrine hormone conditions, develop treatment and management plans, and prescribe medications for you. They're the best ones to prescribe it for you, okay? So how are hormonal imbalances treated? So treatment for hormonal imbalance will depend on what's causing it. If you have lower than normal hormone levels, the main treatment is hormone replacement. So depending on which hormone is deficient, you may also take oral medications or injections, okay? So for example, if you have a low thyroid hormone level, your provider may prescribe a synthetic thyroid hormone pill. So it depends again on what it is. So treatment options again include medications, can be surgery, can be radiation therapy, or a combination of any of these. To continue, if you have any benign, it could be cancerous things that are causing this. So tumors can cause excess, what's called prolactin, a hormone. Your provider may prescribe medication to shrink that tumor, or you may need surgery to remove it. So many health conditions that involve hormonal imbalances, such as diabetes, thyroid disease, require medical treatment. So you want to make sure that you follow up with your doctors, please. So here's what some people have asked. Is there vitamins that treat hormones? Now, there are some vitamins that are known to treat some hormones. So vitamins like your B12s, your B6, your B3s are essential in helping to regulate hormones. B12 helps to create the adrenal hormones, adrenaline and cortisol, while B6 is essential in regulating estrogen levels. Magnesium, probiotics, omega-3. So omega-3 are hormonal precursors needed for the production of estrogen, progesterone, and testosterone. Not getting enough omega-3 is often a factor in developing hot flashes and other menopause discomforts. Evening primrose is also another one, and what's called breast health. Zinc. So a deficiency in this mineral can result in a thyroid hormone imbalance and symptoms of hypothyroidism. So some food sources that are good for hormone. The best of me, you didn't know that. Let me tell you some things. So cherries. If you suffer from insomnia as one of your hormonal issues, snacking on cherries can help because cherries are a natural source of melatonin. I bet Brother Rob didn't know that. The sleep hormone released by your pineal gland. As you age, you produce less and less melatonin. Studies have found that cherries have the ability to increase melatonin levels, total sleep time, and quality of sleep. Cherries also contain other hormone balancing nutrients, including magnesium and vitamin C. Apples. You always say apple a day keep the doctor away. Well, apples contain a key compound, calcium D-glucarate, that helps detoxify estrogen from the liver and improve overall estrogen metabolism. needed for hormonal imbalance. Fiber in apples helps to flush this estrogen out to the colon. Pomegranate. So pomegranates, some people don't like the taste. It's kind of a little tarty sometimes. This helps by acting as a natural blocker in the body against harmful or excess estrogens. Pomegranates are rich in what's called anthocyanidins, sugarless plant pigments, and flavonoids, which are both important for detoxifying and protecting cells. Pomegranates are also high in vitamin C and also rich in vitamin A and E and folic acid, which are all important for healthy hormone production. And the supermarket's going to be flooded today if you buy these things, I'm sure. So test and diagnosis. So there are no single tests available to help doctors diagnose a hormonal imbalance. So you want to begin by making sure that you make an appointment with a doctor. If you feel like, if you're not feeling well, right, any kind of symptoms, whether it's feeling hot, cold, whatever, just make sure you write these things down, when it happens, what were you doing, and be prepared to describe these symptoms to your provider. Bring a list of any medications or vitamins or supplements that you may be taking, because maybe they're the ones that's actually causing it, all right? But the doctors can do blood tests, and there's also at-home tests that you can do at home. But these tests also require them being sent off to a lab to get checked, okay? If you're experiencing symptoms of hormonal imbalance, you may also consider using the home test. These kits are available in for a variety of conditions. Home testing kits typically use your saliva, blood from the fingertip, and some tests may actually really need your urine. So there's a company called Let's Get Checked that provides at-home tests that have been approved by the FDA, just in case you're maybe interested in that. But make sure your doctor knows that you're doing it, okay? So how can I prevent hormonal imbalance? Well, while many hormonal imbalances aren't preventable, there are certain things you can do to optimize your overall health, which could help keep your hormone balance, including maintaining healthy weight, eating a balanced, healthy diet, exercising regularly, managing your stress, getting enough quality sleep, managing your chronic health conditions as well. That is, if you have any, which is important. And if you're smoking, quitting smoking or using tobacco products. So important to know. Because your body makes over 50 different hormones, all of which contribute to important bodily functions, you could experience several different symptoms depending on which hormonal imbalance you have. It is important to know that many of the following symptoms could be caused by other conditions, not just from a hormonal imbalance. If you ever notice a change in your day-to-day health and are experiencing new persistent symptoms, it's important to talk to your healthcare provider, no matter what you think the cause might be. While many of these imbalances require treatment, some can be temporary and may go away on their own. Hormones are complex and powerful chemicals. If one or more of them goes out of whack, it can cause certain symptoms that make you feel like you're not in control of your body. If you have new or persistent symptoms, it is important to talk to your healthcare provider. They can order some tests to see if a hormonal imbalance or another condition is the cause. The sooner you reach out for help and the treatment, the sooner you'll be able to feel yourself again. I want to give special acknowledgement to Verywell Health, Healthline, UCLA Health, Women's Health Network, Biotimen Hormonal Imbalance, Medical News Today, and the Cleveland Clinic for the information that I provided to you this week as well as last week. Now, should you have any questions, feel free to join us in the Zoom room immediately after service. We'll be happy to answer those questions for you. God bless. Thank you so much for your time and enjoy the rest of the service.